twice the national rate. Just about twice the national rate in Massachusetts. While they've established something like 22 new state bureaucracies to control all this. But I've got the Constitution right here. Just note that the Constitution is 18 pages long, which is under 1/100th the length of the 1,990-page healthcare bill. Right on the face of it, what we need is a 20-page healthcare reform bill. That's what we need, a 20-page bill that everybody can understand. So we have a healthcare bill that is more than 100 times longer than the U.S. Constitution. And I read the Constitution cover to cover just for this lecture to see, for my own eyes, whether I could see the constitutional authority for any of this. It is not there. It is simply not there. The federal government is given the right to, is given the power, not the right, the power to regulate commerce among the several states. To regulate commerce among the several states, right? To regulate commerce between the states. Does this mean to impose a bureaucracy and control commerce? No, that is not what the founders did and not what was done in the first generations of the American Republic. What it means is to prevent trade barriers by the states. North Carolina is not allowed to put up toll booths in the border with South Carolina and charge an import duty. Or put a tax on people coming in, right? Coming in. What it would mean for healthcare is this, that the system that's developed right now, which involves massive state control over insurance, is blatantly unconstitutional. Because right now the states control what insurance can be sold in any particular state. When I moved here just about 2 years ago from Ohio, the insurance that I had in Ohio could not be used here because it didn't meet the state guidelines. So what healthcare reform would require would be a recognition in the Constitution that these are trade barriers by the states, and to stop that and allow people to buy health insurance and to keep it with them portable. It's your life, right back to rights again. Why can you not buy insurance on your life, pay for it, and take it state to state? And the answer is because Congress has failed utterly to confront the power of the state governments over insurance, and in fact, in these bills, is strengthening it. Strengthening it by putting greater and greater mandates on the states and giving them greater and greater control. They're doing exactly the wrong thing constitutionally and economically. And so it's another reason why I oppose the bill. So there's much more to say about the constitutionality of this. I will quote from the Supreme Court decision of 1925, which was a case in which the federal government brought suit against a doctor for prescribing a narcotic to someone who was an addict. And this is what it said, quote, direct control of medical practice in states is obviously beyond the power of Congress, unquote. That's the Supreme Court, that's a Supreme Court precedent. Regulation of medicine within the states is beyond, obviously beyond the power of Congress. So there's no constitutionality of this. Now, we've got about 18 minutes to 12 here. Let me just summarize this all up for something. Let me just summarize this up this way. When I as a patient go see a doctor, I'm depending on one thing more than any other thing, and that is that doctor's competence and ability to think and to act on my case, looking at me as an individual, and bringing in a wealth of knowledge, including statistical knowledge, including knowledge of studies, including general knowledge of anatomy and physiology to help me. I'm relying, in other words, on that doctor's use of his or her mind, and that doctor's ability to prescribe and to act as the doctor sees is right for me. I can see no basis in morality for the power of the federal government. Now let's understand that all of these healthcare proposals we're talking about are to be enforced by the power of the state. Congress is not making any suggestions. It is to be enforced by the power of the state. The root of all state power is enforcement. And enforcement by the power of the state. Don't pay your federal income tax bill, and within a very short period of time after you get your tax notices and all that, men with guns will come out and seize your property. That's the root of state enforcement. And we want the state to do that against criminals. But how about against us and my doctor for making a decision that the state may not like? That is what we're talking about in this health reform debate. And that is why I think, going back to it, the thing that has been missing from all of this, and the thing that you should care about and I care about, is the rights of doctors and medical professionals to practice as they wish. in voluntary cooperation with others. I think if you think about it, then the road to reform actually clears out what would be a proper reform, and we need reform. There's no doubt about that. We need reform. It would involve breaking the power of state governments over insurance. It would involve challenging the idea that health insurance should be attached to your employer. Where did that come from? And the answer was it came from wage and price controls in World War II and the immediate years after World War II, where the federal government unconstitutionally set wages for workers in the United States. And factories and employers wanted to give raises, but it was against the law to do so. So much for the government being on your side and corporations wanting to keep everybody at a subsistence level. So the companies got around the law by giving insurance. And now for 2 generations, people are starting to get used to the fact, they have gotten used to the fact, that it shouldn't always be there for them, and thus it is now being morphed into an alleged right. I think that therefore, by making insurance portable so that individuals can buy it on the terms that they want, and that those contracts to be enforced by the government, is the proper route to health care. And that would acknowledge and identify and defend the rights of doctors to practice as they see fit, and the rights of patients to look for the doctors that best suit their needs. That's what I have, and I'm hoping we can have some discussion. I'd like to know what you think about this, and pro and con. Thanks for this opportunity. Go for it.
So you mentioned doctors should be able to, part of the central part of your argument is doctors should be able to use whatever factors they want in deciding how to treat the patient.
Right. Involuntary agreement with the patient, yes.
Right. What about the patient's ability to pay for their services?
Well, it's the patient's ability to pay for this. It's interesting, one argument I've heard repeatedly is that there are vast numbers of uninsured and that they're loading down the healthcare system. There's people going to the emergency rooms at 2 o'clock in the morning and we're all paying for them now. And then I looked at the figures for that and found out that in total cost of healthcare spending that amounts to about 4%. I think that if you held this in context and realized that you would have so much more control over your life and so much more control over your own expenses, that charity would become less of a problem. The fact is that somebody who can't pay for anything and needs it, needs charity. They need the goodwill and good grace of others. You know, charity in Greek goes back to charis, which can translate as the graces. Needs the goodwill and graces of others. And I would voluntarily, gladly, pay money into a fund that helped people that way if there were people who genuinely deserve the help. Just because someone needs it desperately and needs to rely on charity does not give them a right to therefore demand it as a right. That's what it comes down to. What it would come down to is, I need health care desperately. I can't pay for it right now, so therefore I have the right to call the police and have them take your money and give it to me. That's what it comes down to in this massive redistribution, and it's not changed in any principle if it's distributed out amongst millions of people and done by forms and payroll withholding and all that. It's basically the same thing. It comes down, it's a very good question because it comes down to this. Does someone's need therefore create a right? Does someone's need create a right? And